Preoperative anemia is common in patients undergoing elective cardiac surgery and is associated with a range of poorer outcomes postoperatively. In 2015, NICE published guidelines recommending surgical patients with iron deficiency anemia to receive IV iron prior to their surgery. And in response to this, Evans et al. Set up the Cardiff pathway in 2017 to reliably identify those patients who are anemic and iron deficient. We looked at 139 patients, 71 who were treated with IV iron and 68 who were untreated. These patients have been identified as anemic and iron deficient by the Cardiff pathway. The treated group was then further subdivided into being treatment responders. This was defined as having a haemoglobin level greater than or equal to 130 grams per litre on the day of surgery, and 31% of the treated group were classed as treatment responders. Our primary outcome was assessing mortality, and our secondary outcomes included serious adverse events and major adverse cardiac and cerebrovascular events occurring within 90 days of operation. Clinical events we included as major adverse cardiac and cerebrovascular events included stroke, TIA, a myocardial infarction, sustained angina pectoris, and hospitalisation due to heart failure. Other serious events included any adverse event that resulted in death or was life-threatening, caused prolongation of existing hospital admission, requires a readmission to hospital or presentation to secondary care, with readmission to ITU or a return to theatre. The survival curve shows the improved mortality in those patients treated with IV iron compared to the untreated group. None of the IV iron responders died within 90 days, and only one IV iron responder died within the follow-up period, at 323 days after surgery. The differences in survival between the groups were not statistically significant. And when looking at postoperative complications, we found there not to be statistical difference between the groups. However, the untreated group had more readmissions to hospital and more presentations to the emergency department within 90 days of their surgery. No patients from the treated group were readmitted to hospital within 90 days, but 4 from the untreated group were. 13.2% of patients from the untreated group presented to the emergency department compared to 4.2% from the treated group. So we showed there was a trend of improved 30 and 90-day survival in patients who were treated with IV iron for preoperative iron deficiency anemia, and we identified a reduced proportion of readmissions and emergency department attendances in the treated group. These findings support trends of other studies suggesting benefits of treating preoperative anemia.